Top 3 vitamins. Every diabetic should take lower blood sugar. Very often, during a medical appointment, you're advised to reduce sugar intake or to carefully follow prescribed medications to manage diabetes. However, it's rare for anyone to delve into how crucial the role of specific nutrients is in supporting the body under these conditions. As stated by the Journal of Clinical Endocrinology, chronic micronutrient deficiencies can impair insulin sensitivity and increase the risk of complications. A notable example is vitamin B6, whose demand significantly increases in patients with high blood sugar levels. A lack of essential nutrients not only compromises insulin effectiveness, but can also accelerate the onset of complications and weaken the nervous system. Surprisingly, many people with diabetes have significant nutrient deficiencies without even realizing it. Have you ever experienced constant fatigue, unexplained aches, or trouble keeping your blood sugar stable despite your best efforts? It could be a hidden nutritional gap that, once corrected, may greatly improve both your well-being and diabetes management. Have you ever wondered which nutrients are truly essential for managing diabetes effectively? Let's explore the most important ones and how you can easily incorporate them into your daily routine. If you find this information helpful, subscribing is a small gesture that helps us continue sharing valuable content. Let's start with vitamin B6. Often overlooked, this vitamin is critical for those living with diabetes. Elevated glucose levels in the bloodstream accelerate the loss of B6 through the kidneys, along with the excess sugar. Additionally, the inflammatory processes and oxidative stress commonly associated with diabetes further deplete this vitamin, making it even scarcer in the body. High levels of insulin can interfere with proper B6 metabolism, and several commonly prescribed medications, like those for blood sugar control or high blood pressure, further reduce the availability of this vitamin. The result? Many people with diabetes experience chronic B6 deficiency without any obvious symptoms. Subtle but important warning signs include fatigue, difficulty concentrating, mood swings, as well as physical symptoms like tingling, burning, or numbness in the extremities. Muscle weakness, motor coordination issues, dry or irritated skin, frequent mouth sores, and a weakened immune system are other signs to watch for. In more severe cases, anemia may develop, bringing symptoms like dizziness, pale skin, and shortness of breath. This vitamin is also essential for reproductive health. In men, deficiency can impair sperm quality and lower testosterone levels. In women, it can cause irregular menstrual cycles and more severe premenstrual symptoms. Libido may also suffer due to reduced dopamine and serotonin production, both crucial for emotional well-being. The nervous system heavily relies on vitamin B6 to repair and protect nerve cells. A deficiency can worsen neuropathic pain and slow down healing processes. Kidney health may also be impacted, as B6 plays a vital role in managing renal inflammation. When it comes to eyesight, insufficient levels of B6 compromise the microcirculation in the eyes, accelerating retinal damage associated with diabetic retinopathy. The cardiovascular system also suffers. B6 helps regulate homocysteine, a compound that, in excess, can stiffen the arteries and raise the risk of heart attack and stroke. At the cellular level, B6 is essential for glucose metabolism, allowing the body to convert glycogen into energy gradually, avoiding sharp spikes and crashes in blood sugar. It also supports hemoglobin production, ensuring proper oxygen delivery to tissues and aiding in recovery and energy levels. Thankfully, vitamin B6 can be obtained through a variety of foods. Chickpeas are an excellent source. One cooked cup provides more than half of the daily requirement. Beef liver, wild salmon, turkey, and sunflower seeds also offer significant amounts. For those who enjoy gourmet meals, Several dishes are rich in B6, miso glazed salmon with chickpea puree, beef liver pâté with roasted potatoes, or spiced lamb stews with legumes. Alternatively, high bioavailability supplements like P5P, the active form of B6, are readily absorbed and effective. But be careful, some habits can worsen deficiency. Eating refined grains, following a high-sugar diet, consuming alcohol, and taking certain medications can interfere with B6 absorption or accelerate its loss. Monitoring your nutritional intake is essential. Now let's move on to vitamin E, a true protective shield for the body. This fat-soluble vitamin plays a vital role in safeguarding cells, nerves, and blood vessels from oxidative damage. People with diabetes consume more of it due to the high oxidative stress caused by elevated blood glucose levels. Moreover, since its absorption depends on the presence of healthy fats, individuals with metabolic dysfunctions may have a harder time absorbing it. Early signs of deficiency can be subtle: weakness, poor coordination, numbness, or burning sensations in the limbs, all similar to diabetic neuropathy. The skin may also show clear signs, becoming visibly dry, inflamed, or slow to heal after minor cuts or abrasions. These external symptoms can signal often overlooked nutrient deficiencies. Vision problems like blurred sight, night vision difficulty, or eye fatigue, along with frequent colds and infections, may indicate that your immune system is struggling with oxidative stress. Reproductively, vitamin E plays a key role. In men, it supports sperm production and fertility. In women, it helps balance hormones, regulate menstrual cycles, and reduce PMS symptoms. Additionally, it can enhance libido and sexual response by improving blood circulation and reducing inflammation, both crucial for overall well-being. The nervous system, kidneys, eyes, and heart all depend heavily on vitamin E to withstand oxidative stress caused by free radicals, which tend to accumulate in individuals with high blood sugar. This vitamin acts as a powerful antioxidant, protecting cell membranes and aiding tissue regeneration. It helps keep arteries flexible and supports healthy circulation, contributing to better blood pressure control. Its anti-inflammatory properties are essential in reducing chronic inflammation, which can exacerbate diabetic complications. It also prevents LDL cholesterol from oxidizing, a key factor in arterial damage and the development of atherosclerosis. For all these reasons, vitamin E is crucial in preventing cardiovascular diseases, including heart attacks, strokes, and heart failure. Foods rich in vitamin E include sunflower seeds, almonds, hazelnuts, cooked spinach, and avocados. Gourmet dishes that deliver high amounts of this nutrient include almond-crusted sea bass, roasted duck breast with hazelnut glaze, or avocado and seed tartar with truffle oil. If necessary, high-quality vitamin E supplements can help. The natural form, D-alpha tocopherol, is preferred over synthetic versions. When choosing a supplement, look for those that clearly specify the natural form and contain a balanced mix of tocopherols. Opt for reputable brands known for transparency and quality. However, excessive doses can thin the blood, so it's best not to exceed the recommended amount and consult a healthcare provider if in doubt. To round out the essential nutrients for diabetes care, we can't overlook vitamin C. Often only mentioned in the context of colds, this vitamin also plays a vital role for those with elevated blood sugar. High glucose levels reduce its effectiveness, as glucose and vitamin C compete for access to the cells. Frequent urination, typical in people with diabetes, further accelerates the loss of this vitamin, increasing the risk of deficiency. Vitamin C is necessary for collagen production, vascular health, and proper immune system function. A deficiency can lead to slow wound healing, bleeding gums, fatigue, and joint pain. In more severe cases, it can contribute to anemia. This vitamin also supports fertility, nerve function, kidney health, and helps protect the retina. It also aids in preventing plaque buildup in the arteries, helping maintain vessel flexibility and reducing the risk of heart disease. Foods high in vitamin C include kakadu plums, acerola cherries, red bell peppers, kiwis, and strawberries. Gourmet dishes that deliver large amounts of this nutrient include tropical ceviche with kakadu plums, citrus marinated tuna tartare, or acerola cherry sorbet with dark chocolate shavings. All delicious and nutrient-rich. Among available supplements, liposomal vitamin C is one of the most effective forms. It's encapsulated in phospholipids, allowing it to be absorbed directly into the bloodstream for enhanced bioavailability and faster action. This formulation is especially useful for those who struggle to retain nutrients or face high oxidative stress, as often seen in people with diabetes. Beyond supplementation, it's crucial to adopt habits that help maintain vitamin C levels. Avoid excess refined sugars, alcohol, harsh cooking methods like deep frying and smoking, all of which deplete this vitamin. Instead, prioritize fresh, raw, or lightly steamed foods that haven't been overly processed. In conclusion, nutritional deficiencies can hinder diabetes management far more than most people realize. Vitamins like B6, E, and C are not just supplements. They are essential allies that support vital functions, protect organs, and enhance overall quality of life. Maintaining adequate levels is a valuable investment in daily health. If you suspect a deficiency or want to optimize your diabetes care, talk to your doctor. A personalized evaluation can truly make a difference. I would love to hear what you think in the comments below. Subscribe to the channel and activate the bell so you don't miss any content, and thanks for watching this video.